Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Vienna, Virginia, discussing the benefits of laser dentistry and how it can give you the healthy and beautiful smile you've always desired, with minimal discomfort and downtime, with one of this area's top dentists, Dr. Barry Laurent. Dr. Laurent earned his dental degree from the Medical College of Virginia. He is a member of the Academy of General Dentistry and the American Dental Association. Dr. Laurent is also a board member of the Northern Virginia Dental Clinic. Welcome, Dr. Laurent.
Well, hello, Rocco. Thanks for coming with your crew to talk to me about lasers. I can't wait to give more information because I've been doing dentistry since 1983. And I think that the new technology of lasers has just opened a whole new world, not only for dentists who use lasers, but also for patients who can enjoy the benefits of those lasers.
Well, speaking of laser dentistry, I wanted to begin by asking you, Dr. Laurent, if you can tell us what it is and how it can benefit so many of us.
I won't go behind the science of lasers because unless you know physics, it's difficult. The end product, though, is that focused beams of energy can be generated by the laser. And those focused beams of energy can then be used to do marvelous things. They can be focused onto water droplets. Those water droplets can then develop energy, which can then be used to remove decay that's within teeth, can actually make soft incisions in gums, can actually adjust the heights of bones. What's very interesting about the laser energy is that the body seems to respond very positively to it. The reason is that lasers, because they are soft and cool, don't produce friction and heat. They're the traditional way that we used to drill on teeth, and we still do, because lasers are a tool in our toolbox. You can't use it for everything, but where you can use it to substitute for what we used to do, the results are marvelous. Traditional way of removing decay, you would have to numb the patient. You would then have to take a diamond abrasive in a high-speed handpiece, which we still use, and through friction, cooled with water, we would remove the decay. And then we would place a filling or put a crown, however we're going to restore that tooth. The same thing with doing dental surgery procedures, where we would have to adjust the height of the gum, remove excess gum, or there are times where we have to adjust the height of the gum as well as the height of the bone because of disease that the tooth had. The traditional way of doing it with the dental high-speed handpiece, using hand instruments, I won't use the words that we use for them, but they use friction, they use heat, electrosurgery, which is used in the medical environment, and the dental environment, we used it very well for years, uses electrical heat. The body does not like heat, and if you can control the heat with a cool laser, you have the best of both worlds. We can actually remove diseased material, whether it's tooth or gum or bone, and the body heals remarkably to that.
Well, that's certainly very interesting and very impressive as far as the advancements in technology and where they've taken us as far as laser dentistry. I wanted to follow up by asking you, Dr. Laurent, if you can tell us, so we all understand what we're looking at regarding laser dentistry, how is it performed?
And a little bit later, we'll actually have a patient, and I'll show you some of the way that it's performed. But it has a handpiece, very similar to the dental handpiece, attached to the portable laser unit. And we attach very, very small, they're glass cylinders, almost like dental burrs, but they're not. They never touch the tooth. Those are focusers. They focus the laser energy to the very tip of that little tip. No pun intended, but it does, and water is sprayed on that. The type of laser that I've invested in, and let me tell you a little bit of history of lasers. Dental lasers really got their first started back in the 1960s. We have now come to a type of laser through technology that gives us the ability to cut soft tissue, gums, hard tissue, teeth, and bone, which is sort of like in between the two, with a cool water mist is what I call it. And the cool water mist is what transmits the energy to the tissue without damaging the tissue. Now, in the past, we would use the friction devices. Got the job done, but a little traumatic. Had to use numbing. Laser devices using the water mist actually many times don't require numbing. And sometimes we're actually able to aim the laser energy at the tooth or the gum at a distance, and that numbs up the tooth or the gum. And then you bring the laser tip a little closer and you do what you have to do. I am using the water lace laser that's made by BioLace, which is probably the largest manufacturer of dental lasers. The water lace laser has a type of crystal that produces the energy that is absorbed by water droplets. And the water droplets become energized. And if you can imagine a small, let's say a pressure washer, you're going to have someone pressure wash your deck. Yeah. Imagine a tiny pressure washer that you can adjust the power of. And at the very tip of our little glass focuser, that's where the energy is. You aim that at the tooth, and you can actually see the tooth disappearing where we have the disease as the water energy, like a small pressure washer, just comes and causes that to vaporize. Prior to the laser, I used a miniature sandblaster, I called it, called microabrasion, because I've always tried to figure out a way to remove the smallest amount of tooth necessary to get the job done. And what's beautiful about a laser, especially when we use our high magnification optics, is its pinpoint accuracy. You're not in there with a big burr grinding, you're in there with a focused beam, so you're only taking away what you need to take away.
It basically takes dentistry to a whole different level as far as precision and efficiency goes, based on what you just told us.
Absolutely. And they're slowly catching on more and more. I think maybe 6 or 8% of dentists are now employing dental lasers. And there's a variety of dental lasers, and I can show you some additional ones. We have dental lasers that we use to diagnose decay. We use the water laser to do gum surgery, as well as tooth cleansing to remove the decay. We're actually able to use the water laser to actually clean and disinfect gum pockets. And we think of dentistry as always taking something away. Take away diseased gums, take away diseased bones, take away, take away, take away. Well, we're finding with the laser that if you put that into a pocket, which is basically where the gum no longer is attached to the root because of tartar, calculus, periodontal disease, the laser energy actually encourages growth of some bone and some soft tissue up back against the tooth again. And I think you're going to see in the next maybe 5 to 10 years a revolution in how we treat periodontal disease based on all the new technologies with laser and other things that we can do.
Quite a few advantages that laser dentistry provides over the traditional treatment options.
Absolutely. And right now you're seeing in dentistry a tremendous evolution of new products, high technology products. It's hard for the dentist to make the decision, where shall he or she invest? Yes. I always look for what can give me the best comfort for the patient, what allows me to do the most different types of procedures, and you have to look at what will have longevity. Yes. I remember back in the 1980s, there was a marvelous solution that had a little, you would drip it on a tooth and it would magically cause the decay to disappear. It was called Cariodex. I invested in that. Yes. No, didn't work. Yeah. So I'm always trying to find those things that do work. And the laser, that puppy works beautifully. I enjoy it. When I see on my schedule, Mr. or Mrs. So-and-so needs to have a laser procedure, yeah, I get excited.
I can see the passion. It's definitely coming through loud and clear. We're now going to meet Mark, who's a patient of Dr. Laurent. Welcome, Mark.
Thank you. It's nice to be here.
Oh, it's our pleasure to have you on. We always appreciate it when a patient in their very busy lives come down to share a few moments of their time with us and discuss their experience that they've had. So on that note, I'd like to begin by asking you, Mark, if I may, if you could tell us what dental problem or problems were you experiencing prior to coming to Dr. Laurent?
Well, previously I had a tooth on my lower left side that had cracked almost in half, and there was no pain involved, but it was getting sort of a little bit unsightly. I think as it wore on, it was starting to get a little painful, So I did seek Dr. Laurent's help in improving the situation.
So certainly it was affecting your life to some extent, the problem that you had.
Yes, it was.
So then you came here. I understand you were telling me off camera earlier that you brought your whole family to Dr. Laurent, not just yourself.
That's right. Actually, they were the ones who found Dr. Laurent first.
Okay.
And they've been very happy with the service. We have 2 teenage sons who have both been patients here and currently are patients. And I thought it would make sense to bring myself on board.
So what did you have done specifically in your case when you came here?
Well, Dr. Laurent had worked with me to describe what the procedure was going to involve, what the end result was going to be, and so he took me through that process, sort of giving me the vision of what he was expecting to do. And last time I was here, I had the laser treatment. Highly recommend it. It's very pain-free. He's very good at the laser treatment, and the staff was most accommodating.
So I take it you were very pleased with the outcome and the results.
Yes, I am.
And for the viewers out there that are watching, and what would you tell them?
Well, I would tell them not to, if they have even a small situation that may not be pain-free right now, I would tell them to seek help immediately just in case there could be an infection or something that would make the situation go from bad to, good to bad.
Okay, and that you'd recommend Dr. Laurent to all the viewers out there?
Very highly recommended, yes.
Well, on that note, I'd like to thank you, Mark, for coming down and joining us and being a guest on our program. And in fact, I understand we're going to see you in a procedure here shortly.
Yes, I'll be on the receiving end today, so
Yes,
I'll be ready.
All right. Thanks again, Mark.
Thank you.
We're now back with Dr. Laurent. I must say, Mark was very pleased, very happy patient.
Well, Mark came to us with a number of different issues. One of the issues was a tooth that had broken below the gum line. Normally when you have a broken tooth, you can put a beautiful ceramic crown on that tooth. But what if it breaks deep below the gum line? Yeah. There's no way that you're going to be able to push the edge of a crown deep below the gum line. The body does not like that. Yeah. So for that reason, we have to adjust the height of the gum as well as the height of the bone that surrounds the tooth a little bit. In the past, we would have to numb the patient up profoundly. We would have to then surgically with a scalpel open the gums like you'd open a book.
Yes.
And for those of the faint of heart, it's what we had to do. And then we would take dental burrs on a dental handpiece, subjecting the bone to heat, and files and chisels. I said I wasn't going to use those words, but that's what we had to do. Yeah. And then we would have to suture down the gum at a lower level, and we would wait 4, 8, 12 weeks so that we can do the crown.
My goodness.
Nowadays, not for everybody, but in Mark's case, we're able to do the gum procedure with the laser. We don't have to elevate or open the gum. We do everything looking down on the tooth. And then we're able to make an impression within 1 or 2 weeks for the final crown to be made. I have had patients where I've done the laser surgery and that very day made the impression for the final crown. Because the laser, when it changes the height of the gum, once you set it at that place, the gum doesn't change. Whereas traditional treatments, you put the gum there, and all of a sudden you come back and the gum's at a different place. It's higher, it's lower. Lasers are able to get very fast healing and a very thorough healing. We're going to be doing a cavity removal today, so I'll be using a slightly stronger setting than if I was to do anything with the gums. I have a I'm inserting the little focusing light tip that I was talking about earlier. It's clear glass, and it's what focuses the laser energy to where we need to do the procedure. All right, very good. Okay. Now, Mark, you're not going to feel anything at all. If any of your teeth are cold sensitive, you may feel a little bit of cold air from the cool laser, okay? Okay. And if so, you let me know, and I can always adjust the settings. Okay, Nadia, let's go ahead and we'll start working on this tooth that has the cavity near the gum line. Are you doing okay?
Yeah, it's a little cold.
A little cold sensitive, that's the cool laser. All right, I'll adjust the power just a little bit so you don't notice that as much. Let's try that, okay? Great, okay. Excellent. And that little tapping sound you hear is the laser energy as it comes out in little bursts like that. All right, how was that?
Good. No
Wonderful.
problem.
Okay, now we're going to go ahead and we're going to put in the white restoration, and you won't even know you had a cavity in the tooth.
Dr. Laurent, I understand you have some patient before and after pictures?
Yes, I have one in particular that I want to describe. It was a young person, maybe around 12 years old. For whatever reason, we don't know why, his gums had overgrown his teeth. And as you can see on the photo on the left, very, very fat, thick gums. And no matter how much brushing or flossing you want to do, those gums will never get smaller. We see the same with young people that don't brush and floss their teeth when they have braces on. The braces come off, they have beautiful teeth, but they have thick gums because of the irritation of the bacteria caused by the braces. With the laser, we're able to, almost as if you're taking a paintbrush, but it's not. Imagine an eraser, and you're lightly just erasing that gum, many times with just topical numbing. Sometimes we have to use regular numbing, but just sometimes a gel is put on the gum. And we just go over, go over, go over, and in as little as 10 minutes, the gums have returned back to their normal state. And if you look on the picture on the right, you see that they have gotten significantly smaller. We also are able to take people who have a tongue that does not move very well because it's attached to the floor of the mouth. It's called a frenum. It's kind of like a web that's, instead of, imagine tissue here, so you can't move your tongue. They can't talk well. They're always, it's just cumbersome. They lisp. With the laser, again, with just topical numbing, 4 minutes, 5 minutes, just sweeping it back and forth, and all of a sudden, and they stick their tongue out. I wish I had one I could show you here. They stick their tongue out, and they can now stick their tongue completely out of their mouth.
My goodness.
The traditional way of doing that with the scalpel blade, it was very bloody, unpredictable. The laser allows me to have predictability and comfort for the patient.
Now, how safe are lasers, doctor?
It's interesting. We are required to always wear safety goggles. Now, what's the definition of safety goggles? Well, for the patient, we always have eyewear for the patient, no matter what I'm doing. If we're cleaning a person's tooth, if we're doing a procedure with the dental high speed, we don't want things flying out of the mouth and getting in their eyes. With the laser, the same thing. We don't want laser energy somehow getting out of their mouth and getting into their eyes. Now, is that possible? With the BioLace laser, you're safer than looking at the sun for a second. There's really nothing there, but we have to abide by the federal guidelines. So everyone in the office wears protective eyewear. Now, what is a protective eyewear I wear? I wear magnifying loupes with safety glasses. Are they shaded? No, because the laser energy does not come through. Yeah. So when you use the word protective eyewear, yes, we all wear protective eyewear, but the laser is extremely safe.
Well, that's certainly very good to know, doctor, and we're almost out of time, but I wanted to ask you before I let you go, you and your practice have certainly achieved a reputation for excellence in the field of dentistry and laser dentistry.
Well, thank you.
And I wanted to ask you, what would you say is the primary reason that separates you and your practice apart from so many of the others?
Every dental practice has its unique flavor, as I call it. And one thing I always recommend is get to know your dentist and stay with your dentist. If you're comfortable and you like the way that he or she is treating you, then don't jump around, because it's good to have continuity. What I love about our office is we have a staff that's been with me for 20 years. Carol, my office manager, is now retiring. Annie is taking her place. So you don't see a lot of fresh faces because we all like working here. It's a wonderful environment. And my philosophy is treat people with respect. Yes. And at the same time, give them options. Don't sell them something to make a profit, but offer them opportunity for them to make the decision. Educate and let them, as an informed consumer, make a decision. And sometimes you don't have to make a decision right away. You can choose, I will think about that. No pressure. But the more you know, the more you come to understand what works is relationship. And that's what I like to have with my patients, relationship.
Well, you certainly care about your patients, and you have a very strong reputation in all these areas, and not to mention cutting-edge technology and the many benefits of laser dentistry that you've already covered in today's discussion. You certainly are a very unique dentist, Dr. Laurent. It was our pleasure and honor having you on as a guest today.
Thank you, Rocco. I appreciate it. And anytime in the future, if you want more information about other aspects of dentistry, I'd be happy to explain them to you.
We'd love to have you back on.
Thank you.